I'm an endocrine surgeon, so I'm board certified in general surgery and fellowship trained in endocrine surgery. So I specialize in all disorders of the thyroid, parathyroid, and adrenal gland, both benign and malignant disease. My training began in North Carolina, where I attended Duke University for undergraduate and medical school. And then I went on to complete a general surgery residency at Indiana University School of Medicine. During this time, I did a surgery research fellowship at Brigham and Women's Hospital in Boston. And then I went on to complete an endocrine surgery fellowship at UPMC, University of Pittsburgh School of Medicine. My training in endocrine surgery allows me to provide patients with the most up-to-date medical care pertaining to thyroid cancer, parathyroid or hypercalcemia problems, elevated calcium problems, and treatment of benign and malignant tumors of the adrenal gland. I can provide advanced laparoscopic and minimally invasive techniques, so small incisions to minimize scarring and healing time so patients can recover quickly. Right before medical school, my mother was diagnosed with breast cancer, and I was really struck by the way her surgery team was so communicative and compassionate with her care. He was more like driving the ship, and so I felt like surgeons were not so much like technicians, and then I felt like they were more physicians, and I liked that aspect. I hold that time and the care that she received kind of close to my heart, and I try to do my best to provide that level of care to my patients. When patients come to see me, they can expect to be listened to, because I believe that diagnosis comes from a good listening ear, as well as a careful and thorough workup. Part of a surgeon's job is to determine the best treatment option, whether it involves surgery or medical treatment. My approach is always conservative. I like to assemble as much data as I can to offer patients options. We have the luxury nowadays to apply a lot of molecular genetic testing to help us put patients in the most appropriate category and kind of hone in on their true risk of cancer and try to limit unnecessary surgeries as well as limit the extent of surgeries. I can give them the most up-to-date information to help them make informed decisions. I want my patients to understand all of the options available to them, both non-surgical and surgical, and to leave knowing that they made the best decision with the best available data. It's very rewarding to be able to bring in definitive care to patients with a cancer diagnosis.